important information about athletic shoes and footwear in general. We have in front of us three representative types of footwear. The most important thing when you're selecting footwear is that it fits right and that it feels comfortable for you. But beyond that, there are a few general things that we find are very important. First thing that we're going to talk about is the age and condition of the shoe. It is not only worn down in the upper, but also the midsole is cracked and discolored. It has obvious excessive wear in the tread. Wearing of this type of shoe for extended periods of time is not going to provide you with suitable cushioning or support and may contribute to an increased risk of pain. We recommend that you change your shoes every 300 to 500 miles from whether you're walking or running, or every 3 to 6 months, whatever comes first. If you do a lot of exercise, you'll be changing your shoes more frequently. So even if shoes haven't been worn much, if they're a couple years old, they're not the shoes that they once were. When you're picking a pair of athletic shoes, there are three main tests that I recommend that you look at to help figure out if that is the right shoe for you. Number one is what I like to call the front to back compression test. What you do is you take the shoe between your hands like so, and you squeeze it or compress it from front to back, mimicking what happens when you step on the ground. We want the shoe to only bend right here where the foot naturally bends, like so. This shoe, watch as I apply a little force, collapses in the middle. This would not be a good idea for someone who has a very flat foot, overpronates, or who needs a lot of support front to back. This is a different sneaker, and as I applied the front to back compression test, you're going to see that it has a fair amount of compression, but it is now only bending where the front of the foot meets the middle of the foot. We're going to do what we call the Pretzel Test. You want to take the sneaker and hold it between your hands, and you're going to mimic what happens when the foot comes down, hits the ground, and turns in. You're going to try to twist it, and we want to see how far does it go. In this case, we say past the mustard because it turns into a pretzel. This sneaker not only is in a lot better shape, but also affords moderately better stability when we try to do the pretzel test. It does come forward and to the side a fair bit, but nowhere near as much as this first sneaker. And then this sneaker, you can see, has what we call a dual density midsole. The gray here represents an area that's much more dense and thicker and helps to prevent excessive what we call pronation or turning in. And then the whiter areas have much more cushioning, and that allows the shoe and the foot to roll over. So as we perform the pretzel test, it gives a little bit, but then it stops. So this is the most stable out of these three sneakers. We have the heel squeeze. You pick up the sneaker and hold it from the front. Use the finger and thumb in the back to pinch in about half to 2/3 of the way down the heel counter. You can see in this shoe how it completely collapses. What that means is that this heel counter cannot stabilize the heel of your foot, and that can allow your foot to fishtail in the sneaker. This sneaker, as we give the same compression test, gives a medium amount, but it doesn't totally collapse. As I compress, there's very little compression. Even if I use extra fingers, it still barely moves. And this is much more important to have for somebody who has low to flat arches and significant overpronation issues.